Hi everyone, this is Dr. Fox. Let's talk about the carotid sheath. In this video, we'll discuss the location and composition of the carotid sheath as well as its major components. The carotid sheaths are condensations of deep cervical fascia. These are connective tissues deep within the neck. These carotid sheaths are located inferior to the cranium, superior to the arch of the aorta and venous angles, lateral and posterior to the infrahyoid muscles, deep to and medial to the sternocleidomastoid muscles, which I'll have to draw in here, and anterolateral to the cervical sympathetic trunks, which we can't see from this angle. So let's take a look at a transverse section of the neck, and we can see the carotid sheaths here. So deep to SCM, posterior, and a little lateral to the infrahyoid muscles. And we can see the contents of the carotid sheaths. So in lab, as you dissect away the carotid sheaths to reveal the contents, the sheaths will no longer be present. So it's important that you have an understanding of what these structures are before you go looking for their contents. So one of the major contents of the carotid sheath is the common carotid artery. The common carotid artery is found most medially within the sheath. As it moves superiorly or distally, it is going to bifurcate into the internal carotid and external carotid arteries. That internal carotid artery may be found within the carotid sheath as it ascends into the skull through the carotid canal. Another major constituent is the internal jugular vein, or the IJV, which is found laterally within the sheath. There are going to be associated lymphatics with the IJV, namely the deep cervical lymph nodes and the jugular lymphatic trunk. These structures may be invisible to you upon dissection unless there's some sort of a lymphadenopathy, at which case the deep cervical nodes may be very visible to you. In dissection, you can part the common carotid and IJV to come across the vagus nerve or cranial nerve 10 that's located posteriorly within the sheath. And then we have a couple of variable associations with the sheath. Sometimes the ansa cervicalis, so that handle of the neck from the cervical plexus, may be found anterolateral to the carotid sheath. Sometimes it may even be within the fibers of the carotid sheath, so sometimes we count it as a content of the sheath itself. The cervical sympathetic trunk may be reliably found posterolaterally to the carotid sheath, so you can see it upon the posterior surface of the sheath as you are dissecting the neck. Now this sheath, these connective tissues, are not only going to contain critical neck neurovasculature, but it will also protect them. During surgical procedures, one must be very careful to navigate other important neurovascular elements of the sheath, but the internal jugular vein found within the sheath is the preferred site for central line placement, so it will be cannulated under ultrasound guidance so that a provider may have access to the cardiovascular system. So we've discussed the carotid sheath, its locations, its major contents. This is your summary slide. Thank you for your time.